Cindy Kincaid. I am the STNA instructor here at Fort County Career Center, and I help teach the nurse aides. And nurse aides also work with the developmentally delayed. So we want to make sure that you understand how to do your skills and do them correctly. And today we're going to talk about blood pressure. Blood pressure takes a lot of knowledge and a lot of skill, and you need to be able to do it correctly. 3 things I always tell students is position, position, position. You have to position the cuff correctly, you have to position the patient correctly, and you have to position yourself correctly. But before we get into that, let's talk about cuffs. You do need to make sure you get the right size cuffs. Cuffs come in all shapes and sizes. Here, of course, is for a baby, for children, large children or small adults, regular adults, large adults. We even have what we call bariatric cuffs that are shaped in a cone fashion for the people who have larger arms. So you want to make sure you are picking out the correct blood pressure cuff. So whether you need a large adult or just a regular adult, these are the 2 most common cuffs that you're going to probably be using. First thing you need to think about is positioning your patient. You want to make sure they're in a relaxed position. You want to make sure that whether they're lying down or sitting, they are straight, there's no pressure on the abdomen, that their legs are not crossed. And if you have them sitting, you want their arms resting comfortably on a table. Then you need to make sure you've got the blood pressure cuff positioned correctly. When you're positioning the blood pressure cuff, there's always this artery mark, and the artery mark needs to go over the brachial artery, which is generally to the inside aspect of the elbow fold. Position this approximately an inch above the elbow fold, and then as you're wrapping it around, you'll see there's this index on the inside of the blood pressure cuff and this white mark. This white mark needs to fit within the index when you're putting it on, and then put it on snugly. Then next, if it is an automatic blood pressure cuff, having them relax with their arm resting comfortably on the table. Hopefully that does not squeak. And tell them to relax and press the button. Blood pressure is not the first thing you're going to do when you walk in the door. It's something you want to do after they've had a chance to relax and catch their breath. If you're actually doing it with the stethoscope, the curve of the stethoscope goes towards your nose. You make sure that the diaphragm is working. Place it over the antecubital space. And then you begin to inflate the blood pressure cuff. It does take practice to be able to do the blood pressure. And you get it up to a rate that is high enough, and we'll discuss that momentarily, how high to squeeze it up, and then slowly release the valve. Just like a bottle of pop, you don't want to over tighten this, because as pressure builds, this will get very tight. So then just slowly release and listen for the pulse as it's slowly releasing. The first bump you hear, the first sound of the heart that you hear, is the top number of your blood pressure. The last time you hear the heartbeat, that is the bottom number of your blood pressure. Then you can finally just release it completely. And that is how you do a blood pressure.